Okay, so we're going to cover chapter 6, the skeletal system, and I'm going to break this into two parts. This first part will be primarily on the anatomy of the skeletal system, and then the second video will talk more about the different disease processes and the different kind of labs and procedures that we would do according to this particular system. Okay, so we'll get started. Okay, and so when we look at the skeletal system, the human skeleton consists of approximately 206 bones, and the primary function of the skeletal system is support and framework of the body. Okay, it gives us bones that allow us to have muscles that attach and allows for movement of the body. If we did not have the bones, we would be sort of a glob of skin and muscle, and so this gives us something to support the body. Okay. With that support, it also protects the vital internal organs, and we'll talk about some of those bony processes and specific bones that actually encompass and protect certain vital organs. We look at the skeletal system as being important for movement, which I kind of already mentioned, but we have attachments for muscles and also for ligaments so that we can connect bone to bone and muscle to bone. Okay. The one thing that sometimes people forget about is that when you think of the skeletal system, you think of it as being not alive, but that's not true. Bone is constantly building and breaking down, and so it's a very dynamic process, and it is very much alive. And so the bone is actually a reservoir for storing minerals. The primary mineral that it stores is calcium, and calcium has a number of very important functions in the body. One of the primary functions is allowing for muscle contraction, and so that storage of calcium is extremely important. It also stores phosphorus and fluoride and some other things as well, but the calcium is the primary mineral that's stored within the bone that we need to break down and utilize. And the other thing too, we have to remember that the skeletal system is our source of blood cell formation. Red blood cells don't have a nucleus, and so they can't reproduce on their own. And so they need to have an external area in the body or an area specific in the body that allows for that to happen. And we have specific bones that are responsible for bone cell formation in the form of and from the red bone marrow. And we'll talk about red bone versus yellow bone marrow, but the red bone marrow allows for blood cell formation. So when we look at classifying bones, we basically look at them according to shape. Okay, and so there's 5 different types or shapes that we classify them according to. We have long bones, which is like our thigh bone and our upper arm bone of the axial skeleton or the appendicular skeleton. So long bones are longer than they are wide. The femur, the humerus would be examples of those. Then we have short bones that are cube-shaped and are basically as short as they are wide. And so the hand bone, or the bones of the wrist and the bones of the ankle are examples of those. Then we have bones that are flat, and the ones in the skeleton, and the cranium are ones that are considered flat. And then we do have a number of a number of bones that don't really fit any particular category, so they have what's called irregular. The pelvic bones and some of the others are classified as irregular. And then we have sesamoid, which is a bone that's usually a small kind of free floating within a tendon, like the kneecap is a common sesamoid bone. So that's just kind of the basic classifications. Then we can actually look at bone structure, the actual bone structure itself. And this is primarily a bone structure of a long bone, like the humerus or the femur. Okay, and so when we look at this classification, we have to be able to break the bone up into specific nomenclature so that we can actually identify and name it. And so I'm going to jump to the picture here because this picture gives a little bit of a better idea of what we're dealing with. And so the edges here are called the epiphyses, okay? And we have 2 epiphyses. We have a proximal epiphyses, which is closer to the body, and then we have a distal epiphyses, which is farther away, okay? And then the long bone in the middle, or the long part in the middle, is called the diathesis. Sometimes you'll hear this called the shaft as well. And if someone were to have a fracture of a bone, sometimes you'll hear it. If it's right in the middle, they'll call it a midshaft, or they might say it's a proximal shaft. It's a fracture proximal or a distal fracture. Classify it according to where it locates. Okay, so epiphyses are the two distal areas. The diatheses is in the middle, and then we have some different kinds internally of what's made up here. And so we actually have compact bone that goes linearly along the diatheses here. And then there's this other area that looks kind of sponge-like, and so this is called the spongy bone. Okay, so bone has a kind of a soft, squishy part, and then we have a hard, compact part. Okay, and then we have an inner canal here called the medullary canal. This is where yellow bone marrow is located, and that yellow bone marrow is composed primarily of fat. And then when we look at the distal areas, this is where we have red bone marrow, which is where our red blood cells are made. Okay, on the very distal ends here, where the distal and the proximal end, we have a thick piece of cartilage called articular cartilage, and that helps to protect and act as a cushion in a joint area. And so each one of these long bones is covered by a thick articular cartilage. And then if we go right along here on the very outer edge of the bone, there's something called the periosteum. The periosteum is a very fibrous covering of all of the long bones, and if that fibrous covering is penetrated, it can actually allow for an infection to get in the bone called osteomyelitis. Okay, and as you can see in here, we have a lot of arterial and nervous intervention going through the middle here, as well as the periosteum. Okay, and so this just kind of makes up the anatomy. One last area here, you can see there's a little bit of a clear area in this spongy bone here, and this is called the growth plate or the epiphyseal plate or epiphyseal line. And this is, we have a high concentration of certain bone cells in this area that actually lay bone here, that allows for linear growth or lengthwise growth of the bone during puberty. Okay. So we'll go backwards here, and I'll just kind of go through some of the things that we talked about. Once again, the diatheses is the main shaft-like or the long portion of the long bone. It has a component of compact bone that covers that medullary canal. The epiphyses is located at each end of the long bone. We have a distal and a proximal epiphyses. The epiphyseal line is also called the growth plate, and it allows for the bone to grow lengthwise during puberty. Those lines will eventually solidify and not allow any more growth, but that's usually once an individual goes completely through puberty. Periosteum is a fibrous membrane that covers the outer surface of the long bone. The articular cartilage covers the joint surfaces, primarily at the ends of the epiphyseal area. There will be an articular cartilage that helps to prevent wear and tear on the joints. The medullary canal is the center part of the long bone that contains yellow marrow. The spongy bone is also called trabecular bone. It's got a number of names. Medicine loves to do this. It's also called cancellous bone, and they're it's kind of web-like bone that's lighter, and that's where the red bone marrow is, and that actually helps to allow that red bone marrow to have a place to reside while making red blood cells for the system. So red bone marrow is that site for red cell production. There are some bones that have higher areas of blood cell production. We're talking a little bit about the hip bone, which has quite a bit of red blood cell production. And then the yellow marrow is a storage of fat, and so it's not an active site for blood cell formation in adult, which is actually in the medullary canal. But in cases where someone needs red bone marrow, something happens and they don't have enough, yellow marrow can actually be converted in the body to red bone marrow if necessary. So we already saw our picture. Okay, and so a question, the bony skeleton serves many purposes except, so that would go back to our very first PowerPoint that talked about the functions of the bony skeleton. And so we talked about structure. It helps provide support. It allows for movement, and it also allows for red cell production. Doesn't have anything to do with digestion, so the answer here would be C. Okay. Okay, so we have to actually look at bone formation because bone has to be formed. And so when we are when we're actually in the womb, intrauterine, we don't really have bone formed yet. Most of our base formation starts with cartilage, and cartilage is the material that our nose and our ear is made out of, the external ear. It's strong yet flexible. But this is actually what our bones start out as, and then we go through a process of laying down bone and converting cartilage into bone. And that bone formation, there's two names you'll see associated with that. Sometimes we'll hear osteogenesis, which is bone formation, but it's also called ossification. And so both of those indicate the laying down of certain cells and minerals and calcium in order to convert a bone from cartilage, to convert cartilage into bone. Okay, and there's some specific cells that aid in this formation. We have a type of cell called an osteoblast, and you can see here these two words are exactly the same except for the one letter here. So an osteoblast is a bone cell that actively produces bone tissue and lays down bone formation. An osteoclast with a C is something that digests or breaks down bone tissue. And it is a dynamic process between these two cells in our body that allows for the building up of bone and the breaking down of bone. And this has to do with the amount of calcium that is within our blood, because we must keep a certain amount of calcium in our blood. And if the blood is sensed to have not enough, then the osteoclast can go in and break down, pull the calcium out of the bone, and then increase the serum levels within the blood. Okay. An osteocyte is actually an osteoblast that has gone through a number of changes and is considered a mature bone cell. It helps to maintain the bone without producing new bone tissue. That's the job of the osteoblast. Okay. And then here's the other term that I talked about, ossification. Ossification is just another word for bone formation, where we're taking connective tissue, fibrous connective tissue, and or cartilage, laying down a bony matrix of minerals, and actually causing that cartilage to solidify into bone. When we look at bones, bones are not smooth. Okay, a bone is not completely linear, not completely smooth. There's a number of markings and depressions and protuberances that are important. They all serve purposes, but it actually allows for muscles to be attached, ligaments to be attached, areas for blood vessels to lie very close to the bone. There's small holes and depressions that are areas for nerves, and so those markings are important because they can actually help identify an area of the bone. And if you have an area that there's a depression or a marking, that can give you an idea of what important structures in that area. So we have enlargements that can extend out from the bone. We have openings within bones. We have hollow regions within a bone. We have points of attachment for muscles and tendons and ligaments. And we also have cavities and passages for nerves and blood vessels. So the bones are equipped to allow all of these features so that we can maintain a complex body structure. You can also have bony depressions. So a depression would be something that's concave or depressed. And those concave or depressed areas generally are going to allow for a joint to come together, or joint formation or articulation. And so those depressions serve as points of attachment for muscles. And then we have another word called a sulcus. A sulcus is a groove or depression in a bone. An example of that is a fissure. We saw the word fissure in chapter 5 last week. And a fissure is like a crack in the skin, but it also can be a groove or depression in a bone. Okay. Another kind of depression would be like a sinus. A sinus is actually an opening or a hollow space in the bone, and that allows for things to be a little lighter. And we do have a number of sinuses within the cranium or within the facial structure, and we'll talk about those in a little bit. And then we have something called a fossa, which is a hollow or shallow concave depression in the bone. And an example of that is the iliac crest of the hip bone, okay, or the iliac fossa. That's also called the crest. Then we have large holes within bones for blood vessels or nerves to pass through. An example of the largest one is actually the foramen magnum of the skull, which is actually on the inferior surface of the skull that allows for the spinal cord to run through. Okay. Now we're going to kind of start breaking down some of the bones in the body. And so the first one will start at the top and move down. And so the first one we'll look at is cranium. And that's actually basically the bony skull. So the cranium envelops and covers and protects the brain. There are 8 bones that compose the cranium. And these 8 bones come together in a type of immovable joint called a suture. Okay, and so these are flat bones that come together, and there's very, very, very minimal movement with these joints. Okay, so an essentially immovable joint is called a suture. Okay, so this gives us an example of some of the facial bones as well as the cranial bones. And if we start here, we have the frontal bone. That makes up primarily the forehead, and then a little farther back, it also encompasses the upper part of the eye orbits. If we go to the top and part of the back, we have the parietal bone. The third one is this posterior area, which is the occipital bone. It covers the occipital lobe of the brain, which is our vision center. The sides on both, there's one on the other corresponding side as well. That's the temporal bone. That kind of covers our hearing processes. Then we have a very small bone right in front of there called the sphenoid bone, and that actually kind of makes up part of one of the sinuses that we were talking about. The ethmoid bone is kind of within the nose, and you can kind of see it through the orbit here. Both of these areas are bones that are associated with hollow cavities within, or sinuses within the brain. Then we have a few bones down over here. We have the big one down here, the purple one. Is the mandible or the lower jaw, and then up here this pink one is the upper jaw or the maxilla, and then the orange one on the side here is the zygomatic bone, and then you can see this bone here called the lacrimal bone. There's a little hole right here, but this is what allows for the lacrimal apparatus or the lacrimal tear gland that allows us to produce tears. Okay. All of these joints here are considered sutures because they come together as flat bones into these immovable joints. The only one that's not true is the temporomandibular joint, TMJ, and that joint can be felt right in front of the ear, about an inch or so in front. You can actually open and close your lower jaw and you'll feel that joint moving. That's the only one in the face and the skull that is not a suture. Okay, so this just kind of goes through the facial bones. We have the upper jaw bone, which is the maxilla. The lower jaw bone is the mandible. All of these facial bones are connected by movable joints called sutures, except the TMJ. This is just an anterior view. You get a little bit better view of the facial bones here. You can see the frontal bone makes up the entire forehead, plus some back here on the top. And kind of the upper parts of the eye orbits here. Parietal bone you can see on the side. We have our lacrimal bone, which has to do with our lacrimal gland. The zygomatic bone is here, which is our cheekbone. The maxilla and the mandible are here. There's a couple of foramen little holes here that are areas where nerves can go through. And then we have the lower, kind of where the septum is in the nose, called the vomer bone. True or false? The immovable joints of the skull and face are called fissures. And we talked about a fissure as a crack or depression, so that is not what the immovable sutures are called, or the immovable joints, they're called sutures. Okay. So as we go down from the head, we now travel down, and so the next part of the axial skeleton that we deal with is the vertebral bones. These are also called the backbone or the spinal column bones. They form the long axis of the body and they protect the spinal cord. We have to have pretty intricate setup to try to protect the neural network of nerves that goes from our peripheral nervous system to our central nervous system, and that's what the vertebral bones function to do. There are 24 sets of vertebral bones, and we'll talk about those. At the end of the last set, we have a triangular bone called the sacrum, and then attached to the sacrum is something called the coccyx, which is also our tailbone. So when we divide the vertebral bodies up, we have 3 specific areas. The top one, we're going to start from the cranium down. So the top set of vertebrae are called the cervical vertebrae. Cervical means neck. There are 7 of these vertebra, and they are numbered 1 through 7, starting at the base of the skull, going downward. The top one is known as Atlas. Atlas is from mythology, holding up the entire world, and so it kind of acts as holding up the entire head, so they call C1 Atlas. C2 is Axis because that particular joint has a rotation or axis, and so C2 is called that. None of the other ones have special names, just those 2. So after we get down to the 7th cervical vertebrae, we then go to our chest area, which is the thoracic vertebrae. So the vertebra in the chest, thoraco means chest, and we number those T1 through T12, going downward. Then the lowest part of the vertebral area before we get to the sacrum is called the lumbar vertebrae. Lumbar means lower back or loins. These are the largest of the vertebral bones because they support not only the upper body but provide support for the lower nerves that innervate the lower part of the body, and they are identified as L1 through L5. After L5, we then have the sacrum, which is a triangular shaped bone at the base of the lumbar vertebrae. That particular bone is 5 fused individual, it's a triangular shaped bone that has 5 fused bones within it. And then dangling off of that is the tailbone or the coccyx. First 3 segments of the vertebral column are named corresponding to their body position, and that would be true. Cervico means neck, thoraco means chest, and lumbo for loins or lower back. Now, we talked about how these bones have to protect our internal organs. So we have a case scenario where we have the lungs and the heart and all of the important big vessels that go to and from the heart, and so we actually have an area that protects those internal organs called the ribcage. And so we have 12 pairs of ribcage, or 12 pairs of ribs. The first 7 that are numbered 1 through 7, the reason why they're called the true ribs is because they actually attach directly into the front part of the ribcage called the sternum. And so those 7 will attach directly into the sternum. Then we have 3 pairs below that called the false ribs. Now they're not false, but they don't directly attach into the sternum. They attach into some cartilage that attaches to the 7th rib. So they're called false ribs. And then we have 2 pairs of floating ribs, 11 and 12. And so they're not really floating, but they only attach to the vertebrae in the back. They are completely open and do not wrap all the way around and do not attach to the sternum in front. And so these are free floating, and they can be a source of injury. If you are hit hard enough and one of those ribs breaks, depending on what side it's on, it could lacerate the liver or it could lacerate the spleen. And so that's why those ribs, you have to be careful with trauma because they are a source of injury, and you can bleed internally if you cause damage to one of those internal organs. So then we have the sternum. That's also called the breastbone, and it is divided into 3 parts. The upper part, it's kind of trapezoid-ish, is called the manubrium. Then you have the long part is called the body, and then there's a pointed part at the end called the xiphoid process. And when you're doing CPR, you like to make sure that you're doing CPR over the body of the sternum, because if you go too low, you can break the xiphoid process off and actually rupture one of the lungs, and so you have to be very careful with that. The clavicle is also called the collarbone, and it connects laterally from the manubrium to the scapula and kind of forms the AC joint, okay? And then the scapula is posterior. It's actually the shoulder blade, and it has a part on it called the acromion, which connects with the clavicle. And it actually forms what's called our shoulder girdle, which is a articulation or joint that allows for free-ranging motion, okay, a ball and socket joint. And then we look at the bones in the upper extremities. Our long upper bone in the arm is called the humerus. There's two bones in the lower arm. One is the radius and one is the ulna. The radius is thumb side, so if you were to put your palms facing forward, your radius would then be kind of lateral on the thumb side. Your ulna would be medial, and it is on the pinky side. And then if we travel down and go to the wrist, we have the carpal bones. The bones of the hand are called the metacarpals, and then our fingers and toes are both called phalanges, okay? So here's our upper body, here's our cranium, and here's our breastbone or our sternum, and you can see this top part right here is the manubrium, and you can see how the clavicle comes off of that and then attaches into the shoulder girdle here. So we have the manubrium here, and you can see the clavicle attaches directly to the manubrium. Here's the body, and then this pointed one is the xiphoid process that we have to be careful of. Here's our rib cage. That first 7 attached directly here into, it's not a very good or accurate skeleton, but these first 7 are the true ribs that attach directly to the sternum. 8, 9, and 10 are attached by some cartilage that goes into the 7th one here, and then 11 and 12 you can't really see, but they're down on the sides, okay? Our humerus is our long bone, our long upper arm bone. The scapula we can't see very well. It's actually the back shoulder bone posteriorly. And then we have the radius is thumb side, and the ulna is pinky side, okay? So as we travel down, we then have pelvic bones, okay? So we've kind of hit the arms, and we went down as far as the sacrum and the coccyx. So now we're going to kind of look at the pelvic bone structure. The pelvic bone is made up of the ilium, and then there's a upper part of the ilium called the iliac crest, which is sort of a flat curved edge. This is a really good source. The flat bone, great source or area for red bone marrow. There's a lot of red bone marrow and red blood cell production in the hip bones, okay? Then we have part of the hip bone called the ischium, which is the strongest, and it's actually the lower part of the hip bones. And then we actually have a cartilaginous joint where we actually have the two pubic bones come together, and it's formed at an area called the pubis, symphysis pubis, where there's a very thick piece of cartilage that brings both of these pubic bones together. We have 2 pubic bones, one on either side, and they connect together at that point. They are mirror images of each other. And then within this within the pelvic bone, we have an area for the hip socket or the hip joint. The flattened part of that joint that allows for innervation with the femoral head is called the acetabulum, okay? And it's formed by all of these pelvic bones coming together, okay? So here we have the triangular shaped bone called the sacrum. The lumbar spine would be connected here, kind of up here, but they don't have it here. Then we have the iliac or the ilium right here. We have this top part is the iliac crest. The pubic bone is right in this area, and this is the symphysis pubic, which is the thick cartilage that brings these 2 bones together. And then we have the ischium, which is this lower part, and then this whole thing together makes up the pelvic bone, or the pelvic area. From that point, we have the longest, strongest, heaviest bone in the body, which is actually the thigh bone. That's our upper leg bone. There's a couple of sites that are important. There's a bony protuberance called the lesser trochanter that serves as an important site of muscle attachment on the side. The greater trochanter is at the top part, and it's an important landmark when you're giving a type of intramuscular injection called a ventral gluteal injection. Then we have sort of a mid part where we have an articulation between the upper the upper leg bone and the lower leg bones, which is the patella or the kneecap, and that's the sesamoid bone that kind of protects that area. And then we have two long bones in the lower leg. We have the tibia, which is the larger and stronger, kind of more weight-bearing of the two lower leg bones. It's also known as the shin bone and is the site of shin splints. If everybody's a runner or has that, it's very painful. And that anterior tibialis muscle will pull off of the shin bone and cause quite a bit of discomfort if you don't have good running shoes or you're running on a hard surface. And then we have the fibula, which is the smaller kind of lateral leg bone that kind of serves as more of an attachment. It's not really a weight-bearing leg bone. Then we travel down and we have the ankle bones. They are called the tarsals. This tarsal area makes up, we have the calcaneus, which is the heel bone, and then another bone called the talus. These ankle bones have two important sites as well. The inner medial area is called the medial malleolus, and then the lateral ankle area is called the lateral malleolus. Okay, and then we travel down the foot and we have the metatarsals, and the phalanges are just like the toes and the fingers in the kind of corresponding to the hand. Okay, and so a question: instead of attaching to the sternum, false ribs connect to the cartilage of which numbered pair of ribs? And so we talked about how the first 7 are the true ribs, and 8, 9, and 10 are the false ones. So 8, 9, and 10 attach to the cartilage, which is pair 7. Okay. And the carpals are to the wrist as the blank are to the ankle. So the carpals are the same thing in the feet as the tarsals are. Those are the ankle and wrist bones. Okay, so I'm going to go ahead and stop here, and then I will pick up and do another lecture for this in just a second. So I'm gonna stop here, and then I'll have part 2 in just a few minutes. Okay. All right.